The truth about berberine. Berberine has been promoted as a miracle supplement for everything from high blood sugar to viral infections. In this video, I'll be helping you to answer one question. Should you take berberine? One of the many reasons why you might want to take berberine is to lower your blood sugar. A meta-analysis, which is basically taking a group of studies together and looking at the overall outcome, showed that berberine was as effective as metformin, that's glucophage, in lowering fasting blood sugar, lowering blood sugar after a meal, and lowering insulin levels, which suggests that it increases insulin sensitivity in people with type 2 diabetes. In a few studies, berberine lowered LDL cholesterol and triglycerides better than some cholesterol-lowering drugs. So does that mean that you should go ahead and take berberine to lower your blood sugar and to lower your blood cholesterol? Of course, it's a bit more complicated than that. While studies have been done on berberine, they are nothing compared to the sheer number of studies that have been done on metformin and on statins. Studies are expensive. What's the point in spending all that money to do studies on berberine when you can't patent it because it's a natural substance, so you can't make any money from it? Drug companies fund a lot of the studies on statin because they make insane amounts of money from selling statins. So sometimes we have to at least consider peer reviews or anecdotal evidence where you, as my neighbor, my sister, my patient, tells me that, oh, I used this for this and it worked for me. So please share in the comments if you've used berberine, what you used it for, if it works, the brand that you used. I'm sure that a lot of people would find that very useful. There are lots of people that have used berberine and found that it brought down their fasting blood sugar, stopped a huge spike in blood sugar after a meal, helped reduce their sugar cravings, lowered their cholesterol, helped them to lose weight, and helped with gut problems. And I've gotten feedback from people who are able to cut down on their medication and sometimes cut it out altogether while using berberine. But guess what? Some people used berberine and found that it made no difference to their blood sugar, didn't change their cholesterol, did nothing for weight loss. And in fact, some people even found that they had horrible side effects from using berberine. So why would you even consider using berberine when there are medications that have been so well studied for lowering blood sugar and lowering blood cholesterol? You may want something that's more natural, and that's a little bit debatable as to exactly how natural berberine capsules are. You may be having severe side effects from metformin, especially diarrhea and weakness. For some people, filling a prescription for metformin may be really expensive. And following on from this, you can buy berberine over the counter and online. Statins are expensive, and statins can increase your risk of developing type 2 diabetes. And you may be having severe side effects from statins like leg pain. You usually hear about using berberine in type 2 diabetes, but some people with type 1 diabetes have found that when they take berberine, they don't need to inject as much insulin after eating. There are other ways in which berberine can be used apart from lowering blood sugar, high blood pressure, and blood cholesterol. Berberine can be used to strengthen the heartbeat, to fight bacterial and viral infections, to reduce swelling in PCOS, and to heal open wounds on the skin. Just like any supplement or medication that you might be taking, berberine has side effects. And the side effects are a lot like the side effects you get with metformin. But funnily enough, some people can tolerate berberine, but they can't tolerate metformin at all. And just like with metformin, the side effects of berberine increase the higher the dose that you're taking. So some of these side effects include nausea and vomiting, diarrhea, stomach pain, gas, constipation, headaches, and drowsiness. Someone asked if she could give berberine to her 7-year-old child because he likes to eat a lot of cakes and sweet foods. I think the obvious solution there is to cut out the junk food. Please don't give berberine to children. Also, if you're pregnant, don't take berberine. If you're breastfeeding, don't take berberine. If you're taking certain medications, you should not take berberine because berberine can extend the duration of action of those drugs and make the effects more potent. So you need to be careful with cough and cold remedies, drugs that help you sleep, drugs that lower your blood pressure, drugs that lower your blood sugar, and drugs that stop your blood from clotting. You should also be careful with berberine if you're taking certain supplements, things like bitter melon and cinnamon for blood sugar, arginine and stinging nettle for blood pressure, garlic, ginger, and ginseng for blood clotting, and valerian and melatonin, which make you drowsy. Taking probiotics with berberine may make your probiotics less effective because berberine can kill off some of the bacteria in your probiotics. You can get berberine in powder form, in gels and drops, and in capsules. Berberine in the powder form can stain your hands and your tongue a bright yellow color. It's also very, very bitter, so it's really hard to take. You'll find berberine most commonly in the capsule form in 400 or 500 milligrams, occasionally 1000 milligrams per capsule of berberine hydrochloride. Watch out for the labeling on some of these supplements because it can get very confusing. It might say 1500 milligrams in big letters on the front of the bottle, but then when you read the fine print, you find that in order to get that 1500 milligrams, you actually have to take 3 capsules because each capsule is 500 milligrams. Berberine hydrochloride is not well absorbed, so they've developed another form of berberine, dihydroberberine, which is absorbed better than berberine hydrochloride. But it's debatable as to whether this better absorption actually increases the effects of the berberine when it actually gets into the blood and hits the organs where it's supposed to be working. Some people say it works better for them. Some people say that there's absolutely no difference. And another problem is that the supplement industry is not well regulated at all. So a bottle may say that each capsule has 500 milligrams of berberine hydrochloride, and you may find that on testing that it has 100 milligrams of berberine hydrochloride or no berberine hydrochloride at all. So it's best to get a supplement that has been third-party tested. That's an independent laboratory has tested the supplements and confirmed that what is on the packet is what is in the capsule. After a quick search on Amazon USA, I found these 2 brands of berberine. The one on the left contains 500 milligrams of berberine hydrochloride per capsule, and the one on the right contains 120 milligrams of dihydroberberine per capsule. You can see that even though you need less dihydroberberine, it is still 3 times the price of the berberine hydrochloride. So if you want to take berberine, you might want to start with berberine hydrochloride and see if it does anything for you. If it doesn't, then you might want to move up to the dihydroberberine. I see no point in spending boatloads of money if you can spend less and still get the same results. No one can say for sure what effects berberine will have on your body if you use it for a long time. There's some speculation that it can cause vitamin B12 deficiency, so you need to watch out for that. And you might want to take a break after using it for 2 years. The dose of berberine that was used in most of the studies is 500 milligrams of berberine hydrochloride 3 times a day. And it's best to take it with meals because this reduces the side effects enormously.